All right. Well, good afternoon or good morning, depending on what part of the country you're joining us from. Happy Friday. It is Friday. And on behalf of everyone here at Advantage Anywhere and our distinguished panelists, I would like to welcome you. My name is Mona Hilton. So, are these crazy times for us or what? I don't need to tell you how insane that everything is out there right now in the senior living and in home care. And that's why we're so honored to have these panelists with us today to give us part of their very valuable time and share their experiences with us. So I think a lot of people have been talking about the challenges of social distancing and the resulting feelings of isolation that a lot of people are feeling. But I think it also carries over into the business world. I mean, think about it. Businesses are not able to network and gather and share experiences like we always have in the past. And I think for a lot of us, that's resulted in people wondering, am I the only person who's going through this? Am I alone out there? Are there other people who are having the same experiences that I am? So that's why it was so important to us to have this panel and hear from these industry experts. We really hope that this is of great value to you, and we'd love to get your feedback. So thank you so much for joining us today. At the end of today, we will be taking questions and answers from you. So feel free to submit any questions you might have in the chat window, and we'll be sure and address as many of them as time permits. And also, if you would like to see more or less of us, you can adjust your Zoom window by that little panel, drag it around, change the size. I don't think you can delete any of us, but feel free to make it comfortable so that you can see what you would like. So with that, it is my honor to introduce today's panelists. We are so privileged and so grateful to have them with us today. Today's panel represents really very diverse perspectives, as you're about to hear. From geography, all the way from New York, which is, is a hotbed, all the way to the southern United States, demographics, the services that you offer, the types of care that you provide, the types of clients that you serve. There's a broad expertise, and I think that's going to add a lot of richness to the conversation. So just like you, I am really looking forward to hearing from them. So with that, I'd like to kind of start from the left. I'm going to give a real brief introduction and let them share more about who they are when they speak. On the left is Frank Turner. Frank is a president and owner of Turner Senior Solutions. They operate and manage multiple communities across the southern part of the United States. And we're very fortunate to have him today. I know how crazy busy he is. Thank you for joining us today, Frank.
You're welcome.
Also, we have Krista Daniela. She has a much longer name, but I'm going to let her share that with you. I can't pronounce most of it. Krista is the Vice President of Sales at the Osborne. The Osborne is an absolutely gorgeous senior living facility in New York. So I'm sure you'll get to hear a lot about that. Also, we have Richard Scaglio. Richard is a Vice President of Marketing at the Osborne. Richard is a brilliant communicator, so we're looking forward to hearing what they've done there. Thank you guys for joining us.
Thank you for having us.
We also have with us Peggy Scoggins. Peggy is the president of Adept Selling. She is based out of Minneapolis, which is another hotbed right now, but she works across the country. So Peggy, we're very privileged to have you. Thank you so much for coming. We also have with us Fred Tyson. Fred is an incredible consultant. He works with a large span of clients in senior living, in nursing homes, in home care, in home health, you name it. He has worked on the project across the United States, and we're so honored to have Fred with us. Fred's also a speaker on different topics, so thank you for joining us, Fred.
Well, greetings from Florida.
So on the Advantage Anywhere side, we have Lance Armstrong, and yes, that is his real name. Lance is the Director of Client Success at Advantage Anywhere. Lance is going to be monitoring the chat. So my challenge to you is to keep him busy with all your questions. See how he can handle that. He's very capable. And also we have Kristen Zay with us. Kristen is the Vice President of Operations at Advantage Anywhere. And today she is going to moderate our panel. So with that, I'm going to turn it over to Kristen.
Thank you, Mona, and welcome everyone. I have a list of questions. These are prepared questions in advance, but we will be opening it to Q&A. So if we don't address any of the questions that you might have, please do let us know. As time allows, we will get to those. First question is, how has COVID-19 impacted your business? And I'm going to hand that first question off to Krista at the Osborne.
Well, I mean, to be honest with you, I almost wanted that question to be, how has COVID-19 not affected your business? Because I think that obviously it's impacted all of our businesses. And it's impacted every aspect of our business, from daily operations to direct care to how we interact with clients. I think the biggest impact is for many of us, our industry is really based on face-to-face. It's really based on developing relationships, whether it's with your residents, whether it's through our home care agency out in the community, whether it's with our prospects, and trying to figure out very quickly, without any real map, how to adapt to that has probably been the biggest challenge and the biggest impact on us as a business. I mean, that's my opinion. I don't know if Richard, you have anything else to say about that?
Yeah, I agree. It's really caused us to have to rethink every aspect of the way that we conduct our daily business. And I think you hit it, right when you said from, our daily operations to how we reach out to prospects, how we do tours, how we do just day-to-day communications, not only with the outside, but also with our staff. We have staff throughout the community, and it's been a challenge, and hopefully we can share some of the successes with you as we get along in the program.
All right. Let's see. Do we have Fred or Peggy? Would you like to chime in on how it's impacted some of the businesses you work with?
Well, I can start. I just started a new project a week before the pandemic hit, working with a large home health company. And the shocking effect it had from doctors' offices being closed down, hospitals not accepting almost any patient, and a lot of home health does elective surgery, physical therapy, occupational therapy afterwards. The surprising thing, I'm working several different states. In Florida, nurses have the option not to accept a patient, and 100% of our nurses refused to accept any patient that had the COVID-19. Oh. And couldn't find anybody to do any of our work that we did have. In Texas, that wasn't true, and they had to accept them, and so it was a little easier there. The surprising thing, I think, was the doctors who just closed shop. I mean, literally closed shop. You couldn't get a hold of them. They went south. I don't know where they went. You could not get a hold of them. So now all of our paperwork that had to be done from the past, we couldn't get the doctors. We couldn't get new orders. We couldn't get new face-to-face. We finally implemented a better telemedicine situation where we could get better face-to-face. But it affected every single portion of our business, including we shut down all of our offices and everybody worked from home. We had about 3 days to transcend all the computers, all the phones from offices into home. And actually that worked out pretty well. That was kind of a nice lesson on how to do it. So it has affected every portion of the business. The last thing was patients themselves did not want anybody to come into either their home or their facility. Many of our facilities said only one nurse, period, end of statement, can come, and they had to be tested, and they could not have gone to any other facility, period. So we had to dedicate a nurse, but if they only had 1, 2, 3 patients, we just couldn't do it. So it affected everything.
Yeah. And Kristen, the only other thing I'll add on here, really kind of layering on to what Kristen and Richard mentioned, the sales and marketing staff, business as usual was anything but business as usual. And so many of them, while they were having to adapt the way they interact with prospects and customers, so many of them were actually even pulled away from those primary responsibilities and repositioned within other departments of the organization to fill in for those immediate needs. And that meant that we had a lot of prospects who we had been nurturing that went without follow-up. And so one of the biggest things was being able to now, as we've gotten a little bit further into this process, picking up those calls again, picking back up those relationships, which can be challenging because it is so important to not drop that follow-up. So I think that was one of the big things that a lot of the companies I've worked with is they had to shift early on in the restrictions and the stay-at-home orders, shift their roles into other departments, meaning that we weren't doing those things we would normally do on our day-to-day selling marketing practices.
Frank, I do want to give you an opportunity if you'd like to chime in on how COVID has affected your business.
Well, I guess I have to speak primarily from the community standpoint because that's where my focus and concentration has been, specifically on that property in Tennessee. And I went up, and this rolled in right after the tornado that we had in Tennessee. So I was up at the property, visiting the property from the Carolinas. I went to Tennessee to visit the property as I do each month, and that rolled right into COVID. So what usually was a 3 to 4 day visit was a 3-week visit. So it rolled right into that, and it kind of we were trying to close out dealing with the damage done to the property from the tornado, and that was pretty severe in some cases, but we were very, very blessed and very lucky that it was not as bad as it could have been. However, we just rolled right into that. We were a bit unprepared, as we all have been, I'm sure. But at the same time, my executive director was out on a very earned vacation in Florida, in fact. And I had 2 other of my department heads that were on vacation, so or out of the property. And so when they came back, they had to be quarantined. So what it left us with is that, okay, what do we do now? I think, and I've told Mona this, is the experience that we had on the property was one of another spark of unity within the team. So what we started doing, of course, when I came back to the Carolinas, and I was quarantined for 14 days even after that. But that's when we started all the Zoom callings and Zoom meetings, as we're all doing now. And we would have Zoom calls, Zoom meetings with anybody of any leadership ability on the property that were there. And we'd end up with like 13 people on the Zoom calls. And what came of that is a very positive thing. I'm lucky this property has had mainly the same leadership since we've built the property in 2007. And I've been on that property since 2007 before it was built and made most of the leadership hires. But we've been fortunate enough, knock on wood, that most of our lead staff have been there since day one. So we already have a close family. We already have a very close relationship between all of our people and the residents. The property has been at 98 to 100% full since 2013. And it's been a really, really good run. But what it had done, these Zoom calls, because I'm a very collaborative type of leader, and I really solicit the help and the input of everybody involved that's having to actually implement the things that we do and the services we provide. So by adding their voice to all of this every morning and saying, hey, look, guys, here's where we are. We don't have answers. It's not like they can call the corporate office and get answers. We had to find these out on our own. And it really brought a sense of unity to that group, even stronger than it already had been. And the amount of courage they showed and the amount of identifying problems or challenges on a day-to-day basis, we had changed policies weekly we were changing policies and protocol because we were just finding our way through it. And they were just so inspirational through the whole thing. They didn't come with just problems without bringing possible solutions and ideas. They were very creative. They thought out of the box. And it's still that way today. We have Zoom calls every day and we still meet every day. And that type of communication has continued. Now we brought in as a partner, which is the doctor of the Tennessee Health Department, and he's on our Zoom calls daily as well. So we really are learning a lot. And I think by knowledge, we've got a little bit of power. With that power, I think it reduces their amount of fear and they're able to do their jobs a lot more effectively. They just didn't want to bring the virus into the residents who were already isolated. So has it changed everything we've done? Absolutely. I think there's a very good thing that it has brought to us, which is this unity and this sense of family within the team that's there. We have 123 residents approximately, and we have about 50 employees. And it's just brought everybody together. Communication has been the key.
Awesome. Thank you very much,
Welcome.
Frank, for that. I'm going to address this one to Krista and Richard. What have you done to address the concerns of the residents and their family members at this time?
I'll start. I think that communication throughout this pandemic has been key. We are located in Westchester County, which was ground zero for COVID-19. We're literally less than 10 miles away from New Rochelle, New York, which is where the first case was reported. So Westchester County and New York in general has been sort of the petri dish for how this was going to go. I would say that to use the word panic would not be overly dramatic. Families and residents were panicked over the news of what was happening right in our neighborhood. And so we took a very proactive role in communicating almost daily with our residents and their families by doing recorded messages from our CEO as well as constant contact email and really being completely transparent. I think that some of the organizations that have been kind of bashed in the media are those that have kind of been cagey or stonewalled about cases in their communities. I think this was so pervasive in the senior housing, senior living communities that you really have to be completely transparent. And we've had cases here, and we were very truthful about them. We were truthful about how we were approaching them. We were truthful how we were working with the Department of Health and with the New York State Governor's Office. So there was a lot of things that we did in a very proactive way that has served us well, and that residents and their families have been extremely happy with. And so I think, there's a pivotal moment when there's a crisis, and you can either go one direction or another. Typically, corporate likes to sit back and say, no comment. I think this, because it was so pervasive and so misunderstood and so frightening, that we took the other direction, and people really wanted to let us know how grateful they were for that. Because the worst thing to do in a difficult situation is to give misinformation or to kind of downplay it. So we were very transparent, very honest, and our residents, our prospects, and the family members have been extremely grateful for that. And I think it has served us well. And I've said this before, and I've mentioned it to Krista many times, the time to have a crisis plan is before you have a crisis. So if folks have not had, have to deal with something like this, the time to plan for it is way before it happens. And we were fortunate to have done that.
Yeah. And I'd agree with Richard. And I think that, it's really funny because I actually run a Zoom meeting weekly which everybody used to think is competitors, which now have become friends. And we were actually one of the first facilities to close our doors to visitors. I think, like Richard said, we have a tendency to get right in there and not sit back and wait. I think we're kind of like those people who respond right away. And in doing that, you had to be extremely transparent about why and what was going on. And the key with Richard was really him working with Nat Anderson, our CEO, and putting together those sometimes very difficult communications. They're not easy when you have to say, hey, today we have 5 cases, yesterday we lost somebody. But at the end of the day, people are really grateful for the honesty, because let's be honest, even in senior living, you can be doing everything right. You can be taking temperatures. You can be isolating. You can be doing our tests, which are so much fun here in New York twice a week. You can be doing all of that. And at the end of the day, you can still have a case. And I think explaining things, over-explaining things, is really important. And I think that was the key to our communication. So.
I applaud that, because you're exactly right. Communication is so important, and they do appreciate honesty, even when it's not ugly, I mean, even when it's not pretty. So good for you. That was great.
I'm going to ask Peggy and Fred the next question. What have you seen out there that organizations are doing that may be on the unique side, or have solved problems, or some out-of-the-box thinking, anything along those lines that you're seeing what the other organizations are doing? I'm going to start. Peggy, would you like to start with that one? I think you're on mute. We are recording this, so there will be a playback if any of our attendees have missed any portion of the call so far.
Yeah. So, well, with the companies I have been working with, as I mentioned earlier, many of them shift their day-to-day activities away from what they would normally do, and especially from a sales perspective, and were, all hands on deck where they needed it. After some of that kind of settled down a little bit as they got their, get prepared, then going back to kind of some of the prospecting and the follow-up, what we found with, which I think most have been very adaptive on using technology, on doing the virtual tours, getting on WhatsApp or FaceTime, and being very creative. I mean, I have one community down in Fort Myers that I'm hoping nobody is worried about peeping Toms, because they'll literally be touring from the outside of a window on first floor. So whatever they can do, because families want to see it. We still haven't changed the minds of customers who aren't comfortable placing their loved ones in a senior living community without physically laying eyes on it. And so by using virtual tours or doing whatever you can to be creative to get their eyes on the property and meet the staff, that's been instrumental. And then one of the other things that I think has been important in this is being able to communicate not just what's going on, but how the current residents are thriving. We talked about some of the messages. Jim Morrison from The Door famously said, whoever controls the media controls the mind. And the media hasn't always been kind to our industry. And certainly we've given them there's been a lot of talking points out there that doesn't shine a positive light on senior housing or skilled nursing. And yet, we know there's a lot of positive things that are happening. And so what I've been really doing is encouraging them to use those platforms. A Pew Research survey recently showed 63% of older adults actually get their news from social media platforms and not the traditional network news or cable news. So how are we using our social media platforms? What are we posting out there that we can the message in those media platforms, and therefore change the minds of those consumers so that they can see the things that are happening, that it's not all doom and gloom. There's some really great things happening. Frank talked about the unity and everybody coming together and all in this. That's happening in every community across this United States. And those are the stories that we've got to get out there, remind people about the passion and the support that every staff person is providing, not just to our current residents and patients we're working with, but those future ones as well.
Good.
Thank you, Peggy.
I'll give a couple of real quick examples of, we'll start with marketing. One of the salespeople's best tool is educational seminars where they go in and buy lunch and do a dog and pony show and everything. Well, that's not happening now. So a lot of the salespeople are doing Zoom lunches. They're buying lunch, delivering it up to 10 different places. Everybody's on Zoom eating and still having the educational. And everybody gets a kick out of it because they get their food and you see their dirty offices and the food laying around, the pizza boxes laying around. Everybody gets a laugh out of it, but it is kind of a unique way of doing it without actually being there. So the salespeople that I interact with have just found creative ways of keeping in touch with their sources, which has been extremely hard. The other funny example of doing something different, one of our PT nurses could not get into a home because they didn't want her in there. She said, fine, I'll stand on the porch and I'll do the PT on the porch while you stay in the house and do it. And we have a video of her out there showing the person how to do her exercises. And it's kind of hilarious because if you didn't know what was going on, you would think she's nuts. But the patients really liked it because they were still getting their PT, but they weren't in contact with the patient. So you just find different ways of doing it. You know, one of our biggest problems was finding protection, personal protection equipment. So we had to work around that too. We just couldn't, I mean, you couldn't beg, borrow, or steal it. And we had to really go around and do different things with it. And we came up with some unique choices. One of our local companies here, a hardware supply house, gave us masks, which was unbelievable. They gave it to us. But there were different ways of doing it. And all of a sudden they were coming out of the woodwork with different PPE equipment. But that was one of our biggest drawbacks. We weren't prepared for the equipment shortage that we ran into.
Thank you, Fred. The next question that I have, it talks about a recovery plan, and we've actually touched on it briefly about having a recovery plan in place. Any words of wisdom when it comes to recovery plans? Peggy, maybe I can ask you about having a recovery plan or recommendations.
Yeah, this is really important. And obviously, I'm going to start with the word transparency. I think transparency is going to be the word of the day. But I think it's important for us to step back and go back to what's happening in the minds of our consumers. When we look at consumer confidence has fallen. And interestingly enough, when you look at the economic indicators, consumer confidence was falling before any state put in a stay-at order or a shelter-in-place order. And so what that means, and what I take from that, is just because state's going to reopen or say we're now ready to start, having visitors or doing businesses the new normal, that doesn't mean our consumers are going to come back to us. They're not going to be there with open arms saying, I'm ready to take that next step. So knowing that, I think it's important for, if you have a recovery plan, wonderful, make sure that you are open and transparent, communicate over and over. And if you don't have one, get one in place. What are you able to do? What can you do? How are you going to do it differently? And have that platform or have that plan something that is a living, breathing document that every staff knows and can communicate. Because at the end of the day, our customers, just because we open the door, just because we get them all clear from a governor, does not mean they're coming back by evidence of they left before the governor said, you can't go. And so when you look at, I just want to reference this for people who are interested in this, there is a company called Morning Consults. Every day, they survey about 6,000 customers across the United States, and they're asking key questions about areas of income and work and health and all those things that kind of make up a holistic economic indicator. And we're looking at about from January, February to May, about a 30% decrease in confidence. And that's not going to come back overnight. So that would be my take right now is, in order for us to change the minds of consumer or make them more confident in what we're doing, we need to have a plan. It needs to be reasonable, and we've got to communicate it.
You know, I want to piggyback off of that though, Peggy, because I think there is also some confusion. I know for us in New York, because of where we are being this hotbed, that your phased recovery plan, or what people think is your recovery plan, follows the county or the district or the part of the country that you're in. And that's not necessarily true, because we're also under the guise of the Department of Health regulations and your governor. So, you know, I think what we see, I can only speak for us, is people calling and saying, well, I heard your restaurants and hair salons are open, so that means the hair salon there is open and you must be able to do tours. And no, we're still considered a healthcare facility. We have very different phases. So your phased recovery plan has to have many different elements. So you have the phases of the county that you're in, and then depending on the type of community, you may have an independent part, but you may have a licensed assisted living, a home care agency, and a nursing home, which if they're connected, they're going to have to use the same guidelines. If they're not connected, they're very different. So I think you have to be very careful too about that program and making sure you explain to people those different elements.
Yeah,
Right.
that certainly created some challenges for us too, because in Tennessee, they opened up the state of Tennessee, and of course they didn't open up senior communities. And my residents were saying, well, wow, everybody's going to Lowe's now, everybody's going to the restaurants and getting their hair done, so why are we kept here as prisoners? And so we just had to overcome that just in the past couple of weeks, in fact. So you're exactly right. There is a difference for sure.
Mm-hmm. I think that brings you into what we might talk about later, which is then the challenge of getting over that hump to get them to want to come in when they say, well, if I stay home, I could have been out already. And I know we're going to talk about that more later. So.
Actually, that's exactly where we're going, Christy. You hit the nail on the head. I was about to ask, how has this crisis changed your long-term sales and marketing strategy? And if so, how specifically? And you just mentioned that those kind of changes are going to be happening. Anything you'd like to add to that? And then we'll go around the panel.
Richard?
Well, I would say that I think long-term, first of all, we've made a lot of short-term decisions to our marketing plan, and that was based on the immediate need. But then also created a longer-term strategy that was a little bit different. One of the things I think that we're going to be kind of stressing a little bit more is safety and security, which I think is something that was always part of our messaging, but I think it's more important now. I think people have a real sense of this being one of the major decision-making practices from those that we've talked to. It's not just the fine dining, it's not the amenities. There's other things now which have come into focus, and I think safety and security is one of them. The other thing is, how did you keep your residents engaged? Well, so many of us were worried about the day-to-day business and the operations of how to keep people safe and the environment secure. And when we were close to visitors and close to family members, we had to keep our residents engaged. So I think resident engagement and how we have weathered that storm will become an important component moving forward. So things that we did, for example, is we created a new section of our website which had digital download opportunities. We had a streaming section. We gave people a lot of opportunities. We had our folks from our activities folks and life enrichment were involved with helping people FaceTime who's never been on a computer. We really had to switch gears, and this became part of a plan that now I think will be part of our messaging moving forward.
Thank you. That's good. Peggy or Fred, would you like to talk about any of the sales and marketing long term, how this might be affected?
Well, if I can be straightforward honest, we've suffered such a huge problem here. A lot of are not even thinking about the long term yet. We're thinking short term. One of the things that we did was a quick survey of all of the outpatient elective surgeries to see when they were coming so we could ramp up our staff. And they just started to coming in this week. We probably had our best week in, well, since really February in that area. And I talk to a lot of companies. They're so worried about their financial, they are not looking at the long term. And that's really a mistake, but that's what's reality. The one thing that we did decide is to stockpile personal protection equipment. A lot of companies got grants to buy it, and I suggested spend every penny of it, put it away, because it's coming again. It may be 6 months, it may be 4, it may be this month, according to some of the studies we're seeing, but to not get in a complacent mode, because I think it's another wave coming. And if it's not this, it'll be something else. We've gone through this how many times in our careers? This is really not that new, but we keep forgetting what we learned in the past. And the last thing for the future is technology, is how the doctors, most doctors do not like technology. They want to be face-to-face with that patient, but how to use your face-to-face, your telemedicine, your electronics to better serve your patients. We have dermatologists doing telemedicine now, which is unheard of. And so long-term, I think that's an area that we can really help. Is the world changed. How can we help you cope with the changing? That's our job. And if we can help you, then you're going to be our best referral sources in the future.
Yeah, I think long term, I think something good is going to come out of this is how we interact with our prospects and families, which is there's going to be a lot more willingness to engage virtually. So that's going to be important when we have families that are out of the area that are interested in helping with the search. And so what I had been working with on some of my teams when we were doing some of the sales coaching during the midst of this, we had a lot of sales staff that said, well, I'm not comfortable calling because one, I can't tour anybody and we can't move anybody in. So what's the point? And so when we started talking about relationship or consultative selling approach versus transactional selling approach, if we're in a relationship and when we're kind of using that sales approach, then we don't just break the relationship when we no longer have something to offer. So what do your customers need right now? What are their situations when they're at home? Whether it be, necessity or just pure entertainment. And so some of our follow-up calls, I'll give you one example, was I had one of the sites who were talking to their customers about, were they familiar with Google's arts and culture app or the website they go to? Well, they hadn't. So we started encouraging them and sending them out links to this arts and culture app, which allows people to do a virtual tour of any museum, see any painting or sculpture around the world. And by doing this, what we've kind of done is we've got them comfortable with virtual tours. And so now when we're saying have a virtual tour of our community, it's not foreign. It's very normal now. So I think long-term, that's not going away. And I think that's a good thing because now we're able to engage more people in the process, especially those who don't live in the same city as the community that they're looking at. And so I think that's going to be good. The other part is going back to what did we have that was available. I know many communities, they didn't even have a virtual tour on their website. So we're scrambling to get any kind of video representation of a tour. And so I think we're going to have to take a look at what are those tools that we have. What tools are we using? I mean, there's some wonderful technology tools that will help us engage with people outside of that face-to-face, which has always been the bread and butter in our sales protocols. And that, I do think it changed in the short term, and I think it's going to stay with us long term.
You know, the only other thing I want to add to that is I tell my sales staff, because when you're relationship building, I try to tell them you have a real conversation with people. You know, you want to ask them, how are you doing today? Well, everybody's doing pretty, let's be honest, pretty crappy, for quite a while. They're stuck in the house. They're not going anywhere. So one of the things I said was, okay, guys, every morning I want each of you to gather good news for the day. Or look up, they have an app, I mean, you've all seen it, which is what went on today in 1945. You know, you're looking at your age group and you're trying to figure out, okay, what things would they be interested? So when you're calling, you're not really selling. And I think that's what you have to really remember. You can't be oblivious to what's going on and try to just blindly sell to people. You have to be empathetic. You have to understand what everybody's going through. So to me, it was, hey guys, let's provide something to this person for this day. And you know what? When we miss a call in a week, they're like, hey, you didn't give me my good news for the week. So, I mean, you have to be really creative about what you're talking about and kind of go out of the norm and really think about, you know, what kind of conversation would you want to have with your own mother or father? So that's become more of our norm on a daily basis. Frank, I don't know what you see where you are.
Same thing. A little bit of where Fred is that we have just been so focused on what's going on with the day-to-day operations and trying to keep everybody safe, et cetera, et cetera. So when the long-term question comes up, I'm with you, Fred. I'm not quite there yet. And this input for me is extremely healthy. So I thank you all for that. But I think that right now we've just been so focused on the day-to-day communication with our residents, our staff, and family members, and trying to make sure that we're doing all that we can to reduce the exposure and so on. And that day is coming. In fact, I had a meeting with my marketing folks just yesterday and said, hey, okay, now it's time that we get together and we start brainstorming as to what does marketing look like tomorrow and 3 months from now, 6 months from now, because yes, there's going to be long-term change. How do we adapt? So all this is good. I'm a student in that question at this point.
One other thing I just want to share, because I think this is important, and this is a prime example of my own mother-in-law. She had been on a waiting list for an independent living senior apartment and had been called more than once, offered an apartment, and turned it down. Well, then when COVID hit, they're extremely socially isolated. And so, and we have a lot of people that are in our pipeline, our sales pipeline, that now I think they see the value of community living, even though we still have social distancing, you're around other people. So the good news is she got a call this week for plans for a fall opening, and she is not passing it up because she doesn't want this to happen over winter. So you've got folks in your database that when things can, if they can loosen up for you and you're thinking about moving new people in, believe me, there is a pent-up demand for folks who missed an opportunity and are very socially isolated. And so this will be important for them to make moves sooner rather than later.
All right, thank you. The next question I have is, if assuming that at some point, as Fred said, we're going to go through something, we have in the past, more than likely we will again in the future. Do you have any messaging that you would do different, social versus safety? Is there anything that you would make sure that you address maybe on the onset a little bit differently than perhaps was done, or any recommendations that you would want to mention? Peggy, I'm going to start with you. I know you just answered that last question, but is there any messaging you would recommend for the onset of something like this in the future?
Well, I think, some of the other panelists talked about this, being ahead of it. Don't wait to get your crisis plan, your crisis communication plan in place until the crisis has happened. It's too late. And I think because this is unique, there are always challenges within senior housing, right? There will always be incidents that create media, and most people have kind of a media plan for that. And often it's less is more. Now with this, I think it's taught us that actually that's just the opposite. More is better, because I think if you can over communicate, then you're ahead of the story and not behind the story. And
Yeah.
so over communicate, get it out there, be transparent. People are reasonable. They understand that this is not, it is, most cases, it's no fault of the provider that this is happening. And so there's empathy out in the community. We just have to trust that they can hear the message, hear it with the right ears, and respond positively. So that's what I would say.
Okay. Does anyone have anything to add to that?
Yeah, I would add one. Most of you are from the assisted living, independent living, and I'm on the opposite side right now with the home health and the PTOT. If you're going to have a crisis plan, include your other providers in there. How are your home health people going to help you? How is hospice going to help you? How is your doctors, your hospital? Bring them in so it's not a surprise. This happens again and you're right back to start with. Now you don't know how to do the services. We've all lived through it, so we all have good ideas on both sides of the field, and work collaboratively instead of as competitors, and bring them in. They have some great ideas. We're trying to bring our home health or our assisted living people into some meetings to see what we could do the next time. But I think you got to branch out and look at the whole area on all aspects. Your food, your activities, your checkups, your podiatrist coming in. I don't know what all that you do, but we find that everybody was caught flat-footed on this one. And one facility did something, corporate says, no, you have to do something else. Another one did something totally different. Some of them were from the same corporation doing different things. And I think that's where we got kind of caught flat-footed. No one knew what to do. Bring all of the aspects. I always say the more people, the better, because you can have a wider view. I call that the world view of it, and plan for the future as if you're all in this together, because you are.
You are. Richard, you know, I think you might want to say something about that too, because I know at the Osborne, so we have, you know, over 230 independent residents. We have about 97 assisted living. We have a memory care unit. We have an 84-bed nursing home, rehab center, and 2 home care agencies, one in Connecticut, one in New York. So Fred, that was a good point, because, you know, all of our services, we had to think outside of the box.
Yeah.
And what I would say about planning now is not just for those types of services. For instance, you know what really came into play are extremely close relationships with hospitals and hospital systems, like the Greenwich Hospital, which is the Yale New Haven system, which we have a really good relationship. We have a medical director from there. We have a clinic. So I think really when you're thinking long term, and everybody has to think short term right now to take care of things, but you do have to think long term, because Fred, I agree, something else will be coming. And those relationships with the hospitals that we had that we could help during this time, they're remembering us. They know they're going to send their clients to us because we were ahead of the game. We developed those relationships. We helped you when you didn't have staff. We shared staff sometimes. The doctor said, hey, all of my nurses aren't staffing the doctor's offices. Oh, well, how can we use that? So, you know, you really have to think outside the box on a lot of those things you wouldn't have thought of before. But if you think about, I think it was Frank or Fred who said, doctor's offices just closed. Well, what do you think happened to all those nurses? There's a nursing shortage. How can we work together on that so we can meet the needs of our clients, whether it's home care, whether it's in your community? Richard, you might want to talk, because you also do the marketing for all of the services as well.
Well, to go back to something that actually Peggy started with was, you know, in a lot of ways, my role did kind of fluctuate a little bit. Whereas I'm the marketing person, I really became the architect for the communications for all of this with our CEO. And I think creation of messaging is super important. I can't say it enough. You have to be honest, transparent, obviously. You have to empathize. Especially when you're talking to your current residents, who are often your best referral source. We know it's hard not to be with your family on Mother's Day. We know how difficult. We had so many things that were difficult for our residents to have to deal with, that when we we wanted to address that. We also wanted to give them the message of hope about when we emerge from this. Those are all super important things for us to do. And again, we've talked about in this together, that message was never more clear throughout this. And when you are marketing, don't forget your employees. Your employees are a very important audience. Although we don't usually think of them as a marketing audience, they need to be, especially during a very, very difficult crisis like this. If you look at a lot of the bad press that some organizations faced, it was based on an employee who came out and said this or said that. So make sure you've engaged your employees in the messaging, because they are important. They are the frontline workers. They're the ones that are treating patients. They're the ones that are taking temperatures. They're people that are super important and are invested. So don't ignore them, because having an engaged workforce will serve you well in your marketing.
Good.
All right. Thank you very much. So I'm going to ask Lance. He is monitoring the chat to see if we have questions that we should be throwing to the panel here. Lance, are there any questions that we could take the few moments to answer?
Yes, we do. In fact, I just want to thank the whole panel for taking time out to go through this. I think it's so important for us to learn from each other. One of the questions that came on is regarding the residents, and with the scope of the people we have on the call, the question is, what's the state of mind of your residents right now?
I'm sure we all have, and I want everybody to respond to that who can, but I want to share something that was a light switch for me and for our team. During one of our Zoom calls, we had already heard this several weeks ago, but it just seemed to be more prominent on this particular call because it seemed the volume had heightened a little bit and the intensity of it had heightened. What we kept hearing from other team members was that residents were really feeling, kind of go back, because we've been fortunate enough to have had a very high level of resident satisfaction on the building. Our team wasn't used to people being uneasy or unhappy with us. So it was a very important thing that they voiced. And what we were hearing is that we were punishing them or we were mistreating them by keeping them locked up. And so after that call, I decided I wanted to hear directly, because as we know, sometimes we can get knee-jerk reactions and they can say, well, all the residents are saying this, but really it's maybe only one or two people. So I wanted to drill down a little bit and really find out where that source was. So I called a small Zoom meeting with the resident council, and I wanted to get their voice on it to either substantiate the input was coming from the staff members or not. So after about probably 45 minutes to 50 minutes of talking to them and just letting them talk and listening, it dawned on me that since March, they have been in one building. They don't know the world has changed. So they're saying, well, we can't do this, we can't do that. There's signs everywhere. You're controlling us. We should have the freedom to take risk if we want to, and so on and so forth. They don't recognize or know that what used to take 20 minutes to go to Lowe's is now an hour and a half. To go to a bank, we've got to stand in line. We've got to stand behind a piece of tape, or we've got to see a sign that says stop and there's a red hand pointed at us. They didn't realize that our world has changed outside of our property because they haven't been out since March. So they obviously took it out on us. That was a light switch for us, because I got to tell you, there was a part of us that assumed that the residents' families were doing that, because we certainly have set things in place to encourage a lot of family member interaction with our residents. But I even went a step further and talked to some key resident family members that I have good communication with that I feel will be very honest with me. And they said, you know what, I haven't burdened my mom with what it's like for me to go to the bank, or what it's like for me to go to the grocery store, and everybody's wearing masks, et cetera, et cetera. And he says, I don't think the other family members have done it either. So what we've initiated as a result of that I guess, a revelation, you may call it, but it's just one piece of information that we've now been able to take action on. And so we've set up, instead of town hall meetings, which we used to have once a month, we're having hall meetings, and we're going to have a Zoom hall meeting in a common space. And instead of having 100 people there, we're going to have 8 apartments of people there. And we're going to have the doctor from the health department on this Zoom call with us, give them a chance to vent and to express their feelings and their opinions towards us, as they've always been able to do. That's just one little thing that we've discovered. There's been a lot of other things, but this is just one thing that we've kind of keyed in on, that really we kind of thought, we didn't know it was as prevalent as it was. I mean, these people feel imprisoned, but they feel like that if they were not with us, that everything would be okay. And we need to educate them that life as we have it is a little bit changed compared to the way it was the ending of March, end of February, the beginning of March. So that was just something I wanted to share with you.
So I'm gonna now give the complete flip side. And our independent residents, so this is the independent residents, you know, I'm gonna say we're lucky enough to have a beautiful 56-acre campus here. So that's quite helpful. But 2 things that I think will speak to the mindset of some of our residents. Our residents realize that even though most people were stay at home, we were all here, we were all working, we were all doing what we can to take care of our residents. The residents decided and organized a noise parade for the staff. They sent out a memo. They asked us to come, for all of us to come through where the independent living was outside, and they were all on their balconies. I've been here for 23 years. My CEO the same. Him and I were walking, and literally I was in tears. I mean, they were saying, thank you for everything you're doing. Not that it's easy for them, because it's not. But I think that did tell you a little bit about their mindset, and I think that would go back to the communication that we had been doing from the beginning, so they understood what was going on. And it just warmed, I think, all of I mean, there's literally hundreds of us walking through, and hundreds of residents with pots and pans and yelling. And it just made us all feel really good. Now, does that mean everybody's happy? No. But, you know, that at least told you a little bit. And I think those 2 things go together. I think if you're communicating, you're over communicating, you're telling them what's going on, they're understanding, they're not feeling in the dark. It was a little bit helpful for us. So I wanted to give like at least one really positive, you know, before we end at some point.
Right. Yeah, we went through a similar thing like that in March, and we provided entertainment outside on a trailer, and we went all around the building. We don't have balconies like you've got, but we did the same thing. And boy, they were just so appreciative of that. And the windows were open, and they had their pots and banging on pots and things like that. So yeah, it's been very awesome.
I don't want to be a downer, but
Sorry. I mean, you're bringing tears to my eyes. But, you know, I think it reminds us, you know, in a time where it's very chaotic. I mean, we've really, as an industry, experienced things that nobody would ever anticipate. And Lou Holtz, a football player and coach, one of his famous quotes was, life is 10% what happens and 90% of how you respond to it. And it's just such a reminder that we have a lot more control over the outcomes than we might realize. And so whether or not we adapt, or how we respond, really can change the outcome. And I think what you guys did, the response you got from your residents, is because what you did. And I say kudos.
Yeah.
Okay, Fred, go ahead. Give us your downer.
so I don't want to be a downer, but the question was kind of how patients are doing, and mentally, physically. Several of our clients had their nurses go through and do a survey of their physical shape. And here's what we found. A lot more falls, a lot more wounds, a lot more medical problems that they never said anything about, because they knew, 1, they didn't want to go to a facility or a hospital, or 2, they just going to keep quiet about it. And now it's worse. So the final conclusion was the people are a lot sicker than before the pandemic, which has to be addressed. That's just something you can't, you know, a lot of times in our clients, they'll have nurses on staff all the time. They take care of the little things and they stay little. It seems like the little things have now gone into almost an acute medical problem that we're having to address now. And it's a lot more work, a lot costlier. And now we still don't have the facilities open, but we have to take care of them now. So
This is your home care agencies, right, Fred?
yeah, this is the home care agencies taking care of those who are now sicker. But we partnered with them to do a survey, and we found that the patients have kind of been lying to us. They were a lot sicker than they told us they were. And maybe this is a part of the mental part of it. I don't want to bother you because I know it's so hard for you to take care of us right now. And that's kind of what we're finding, that some just closed down and they didn't tell the nurse when they had a fall, and now there's, you know, a lot more problems. So that's a mental physical problem that we have to address.
Yeah, we've had that too.
Have you? Okay, so it's just not isolated. Good.
Right. People just, and we have wellness calls on a day-to-day basis, and then we get a call and says, look, I haven't been feeling well for 10 days, ends up
Right.
going to the hospital and didn't live much longer after that. Not to say that we could have prevented his outcome, but I think he would have had a much better chance had it been caught the first day, once he said, hey, look, I'm not feeling well. And we call them every day, and they hid it from us for sure.
Yeah, and that was the word that was used a lot. They hid it.
Right.
Those who were aware of what's going on, I'm not going to take a chance and go to the outpatient or to the hospital.
Right.
And a lot of falls, we have found a lot of falls. So just, I don't know what that means, but I'm throwing it out there because it is very real.
I think you're right in it. So in our assisted living, which is the flip side of independent, that's why I'm saying it depends on what level. One of the things that the staff decided to do was each of us has a list of at least 4 to 5 residents that we usually don't really interact with that much. And it was between sales, administrative, and marketing, and everybody decided, okay, we're each going to have a list of 5 people that every single day, 7 days a week, we're having a conversation with them. So that was kind of our way, because how are you going to get in and do a wellness check, right, on every single person throughout the day? So that was sort of another way. How are you doing today? I have a little bit of a headache. Really? You have a headache? You know, having that conversation and then calling the nurse and saying, no, she sounded a little off to me today. Why don't you go in and take a look? And I think the thing that you mentioned, Fred, that is so important, and being that my background is a master's in psychology, is that mind-body connection is so important. So what ends up happening is the isolation and what's going on mentally is definitely, especially for the assisted living people who need home care out in the community, nursing home, that seems to be the part that has the most effect on them physically. I don't want to get up. What am I getting up for? There's nothing to look forward to. And all of a sudden you're seeing a lot of physical decline because they're not doing the things that they're used to doing. So that's definitely, unfortunately, one of those outcomes that you were referring to.
Absolutely. Well, I can tell you that from just having one eye on some of the comments, all positive comments on that this panel discussion has been very eye-opening, and as well received well from some of the audience, because some of the comments that I just caught out of the corner of my eye say that this actually provided some real discussion on some relevant topics. So I just want to say thank you to the panel here for your time and devotion to being a part of this event here. So I'd love to get to more questions, but I know we've kind of passed our 1 hour mark that we were going to stick to. So with that, I'm going to let Mona close us out with any words of wisdom. And again, I just want to say thank you for fielding all those questions.
It was great meeting all of you, by the way.
Yes, we're all in this together, and this shows that this is a worldwide team effort.
Yep.
Right.
So clearly we could probably go on for at least another hour or so with such great questions and great panelists. And I'm just at a loss for words for thank you to you guys for joining us today, for your transparency, for your willingness to share ideas. I wrote a ton of notes, and I'm sure our attendees did as well. And maybe just a thought as we move forward, we get past some of this, maybe we could do another similar panel on, slightly afterwards and kind of share it, because I think this was extremely valuable. I mean, some of the takeaways were about the innovation and how you communicate and interact and transparency and including partners. And I love the word hope. We didn't hear a lot of hope over the last few months, so it was great to hear you guys bring that up. So I know you're crazy busy, and I know your time is so valuable, and we're so grateful to have you today. And thank you to those of you who attended as well. We're glad that you're on here. We hope you got as much out of it as we did. I'm sure you did. Like Kristen said, based on the chat, it looks like you enjoyed it as well. So thank you so much. I do want to let you know that we are putting together a communications checklist of what to do in times of crisis. And you probably will get those on Monday. And on behalf of everyone at Advantage Anywhere, if you're not already a client, I encourage you to check out the website, sign up for free webinars. Feel free to contact our panelists. They'll tell you what it's like to be a client. And we have a lot of free resources on the website, a lot of videos and articles, what have you. And if you need anything, we are here for you. And again, thank you guys to our panelists. Big applause to you guys. We appreciate you so much. And we hope everybody has a great weekend. We'll see you next time. Bye-bye.
Thank you.
Stay safe.
Bye-bye.
Thank you.
Thank you.
Thank you.